Thank you, Lindsay. Joining us now, Dr. Owais, Durrani, an emergency medicine physician. Good morning to you. Thank you so much for your time. Let's focus in on RFK Jr. We don't know exactly what his role will be in the new Trump administration, but Trump has encouraged him to, quote, go wild on health. We know he has a record of being a vaccine skeptic, though he, as Lindsay's piece described, has said he doesn't want to take away any vaccines. He just wants people to make informed choices. I guess, what concerns do you have about giving RFK a potential role in health policy, given his views often clash with the consensus in the scientific community?
Yeah, absolutely. I'll be honest, it's been a tough week for those of us that work in healthcare. We're still, quite frankly, recovering from a lot of the things that we went through when it came to the pandemic, a lot of the misinformation, a lot of the healthcare violence and burnout because of that violence and misinformation that led to a healthcare workforce that's quite depleted. And now we're looking at the prospect of a man who has no scientific background or training in medicine saying things like going wild on healthcare. I quite frankly don't know what that means. When it comes to healthcare and other scientific institutions in our country, it's based in data, science, and research. And anytime you start to question those without anything that is really backed in data and science, it's honestly going to lead to a loss of life. And so I think right now we are trying to figure out how to make sure that facts and data and science take the lead, whoever is heading healthcare in our country come January 2025.
And listen, you said something interesting I want to dig a little bit deeper on, because I think it's important, because I think it's going to be the start of a trend. We know how deeply Trump values loyalty, and sometimes loyalty ahead of actually being qualified for the job. So let's back up to the big picture. Is RFK Jr., in your medical opinion, in any way qualified in his professional life to take on a leading health role for the United States of America?
No. Last I checked, the head of the FDA is a cardiologist by training. The head of the CDC is an internal medicine physician by training. They obviously have many other qualifications, but they have that deep-rooted background in medicine. And you have to know when you're wrong and when you're right when we get that training in the medical world. You have to follow the data and the science. That's our training. And so a lot of times I may do something in the hospital or for a patient, and all I look at is the data. I may have a gut feeling, but that gut feeling could be wrong because I look at the data and I follow the data. And that is the culture of science. That's the culture of medicine. That's the culture of how we have developed vaccines and why we have certain things in our water systems and whatnot. And when you start to go based off gut feeling and loyalty and what you think sounds good, that's when we get into trouble. That's why we get pandemics, and that's when we, once again, lose lives, unfortunately.
What type of impact would dismantling the FDA have on our food supply?
Yeah, I don't even know how you begin to do that. When it comes to organizations like the FDA, they're functioning when you don't hear about them. So when you go get a certain medication, or when talking about public health in general, when you go to a restaurant, for example, and you come back and you don't get sick, that's public health at work. When your child goes to school and everyone's vaccinated and there's herd immunity for measles, and you don't hear about measles, that's the public health system working. And so when you say dismantle the FDA, that has so many far-reaching implications when it comes to the type of food we eat, knowing what we're eating. I wouldn't even know how that would go about, and it would, quite simply, I'm speechless when I hear things like going wild on healthcare, dismantling the FDA. Those are the core pillars of how society functions and how we are healthy.
It's like a referee in sports.
True.
When you're not talking about them, they're doing their job well.
Exactly. And just real quick, we live in an age of erosion of trust in public institutions and an age of mis and disinformation. Like drink bleach or ivermectin cures COVID or whatever it may be. Do you have any concerns on the flip side of the equation that the public as a country can distinguish the real advice from the BS?
I do. You know, I will be the first one to say, and most healthcare professionals will, that our healthcare system is not perfect. And one of the things that's not perfect about it is an access issue, right? You go back to the 70s, 80s, and 90s. We grew up with one physician. You saw the same pediatrician, same family doctor who took care of your entire family. And so when you did hear something fishy from guys like RFK, you would go to your doctor, you would have that trust, you'd ask them a question, they'd give you an answer, and you'd trust them. Unfortunately, now access is an issue. We're not seeing the same doctors. Getting into doctors is hard. Sometimes it's a telehealth appointment, and every time you log in, it's someone different. And so we don't have that level of comfort and trust with our healthcare system. And so then when you do hear these alternate pseudosciences, you may have questions about it. No one's able to answer those questions. And, you know, some people are going to fall for those things, especially when you have a megaphone like this gentleman does at the highest levels of government. So, yes, it gives me a lot of concern.
Dr. Durrani, thank you so much for your time and your expertise this morning. We really do appreciate it.
Thank you.
Still ahead, senior meteorologist